Next, coming to the types of the RCT, there are of 5 types: clinical, preventive, risk factor, cessation and etiologic. Coming to the clinical, it is concerned with evaluating therapeutic agents like drugs, like evaluation of beta blockers, whether these beta blockers are decreasing cardiovascular mortality in MI acute phases, and folate treatment if taken before conception to prevent neural tube defects. Then aspirin, whether it decreases serious mortality, and tonsillectomy, whether it's useful for recurrent throat infections. Beta carotene in cancer incidence. Then coming to preventive, whooping cough vaccine from 3 manufacturers is taken and it is given to children between 6 to 18 months in separate trials. And these children are kept in some study group and in control group. And the vaccine is given in 3 monthly injections. Less whooping cough cases are seen in study group who received vaccine than those control group who received placebo. Coming to risk factor trials, there are standard 3 community trials, lipid research clinics, multi-risk factor intervention trials, North Karelia and all. In standard 3 community trials, 3 towns are selected in California and 1 and 2 towns are educated by mass campaigns against risk factors for CHT for at least 2 years, and third one is control. After 2 years, there is greater decrease in CHT in 2 towns and it increased in the control group. Similarly, the MRFIT and North Karelia also. Then cessation experiments. Cessation experiments means if a habit is terminated that is related to disease, there may be decrease in incidence of the disease. Like if smoking is terminated, the habit of smoking is terminated, lung cancer and lung cancer cases may be decreased, and it is useful for primary prevention of CHT. Then coming to etiological. Etiological in the sense we need to know the etiology, the causative factor of that disease. For example, in retrolental fibroplasia in prematures, we need to know the cause. So 1500 gram babies are kept in study group and some in control group, and the study group is given 50% of oxygen for 28 days, whereas control group is given oxygen only for emergency. In study group, retrolental fibroplasia is seen, and in control group, retrolental fibroplasia is not seen. Then coming to the study designs of RCT, there are 2 types: concurrent parallel and crossover types. In concurrent parallel, the patients are exposed to the treatment, those patients who are exposed to treatment and not exposed to treatment. That is, some are given treatment and some other are not given to treatment, and we have to compare the outcome of the disease. Then in crossover, patients, some are exposed to treatment and some are not exposed to treatment, and in both of them treatment is cut off after some days. Then those who are exposed to treatment are given placebo, and those who are not exposed to treatment are again given treatment, and we have to compare the outcome. Then coming to the blinding. It's of 3 types: single, double and triple. Blinding is to prevent the bias. Single blinding means the patient is not aware whether he belongs to the control or study groups. Whereas in double blinding, the patient as well as a doctor is unaware of the group allocation and the treatment received. Whereas in triple blinding, the patient, the doctor and the investigator are all blind. Thank you.